Thank you for staying tuned. Now, how are you keeping your mind busy during this lockdown period? Experts suggest reading books, taking online courses, or even learning new skills. Habiba Oladipo in this report spoke to health experts on the mental health implications associated with the lockdown directive.
In January 2020, the World Health Organization (WHO) declared the outbreak of the new coronavirus disease to be a public health emergency of international concern. And with this emergency in Nigeria, most offices, business centers, worship centers and recreational sports were all forced to shut down to curb the spread of the disease, leaving many indoors. Dr. Samuel Junaidu, a senior clinical psychologist, is worried that the lockdown, if not properly managed, can trigger mental disorder.
I think the mental health implication is very, very germane. There are chances that people can start relapsing, people who have had mental health challenges before and they have been stable. There are chances that they could start relapsing on account of the fear and the anxiety that is predominant on account of the spread of the virus.
Dr. Olusegun Soyobo, a consultant psychiatrist at the National Hospital Abuja, believes the palliatives by the federal government will help relieve mental stress, but concerted efforts should be paid to citizens' mental health.
It has to be deliberate and concerted efforts to address possible mental health consequences of the COVID-19 pandemic and the ensuing lockdown as we're experiencing it.
Depression, anxiety, and obsessive-compulsive disorder are some cases the experts say might be on the increase amidst the lockdown.
Nobody is coming in, nobody is going out, but we find spread among the community. So the chances for anxiety, the chances for depression, the chances for obsessive-compulsive challenges, people becoming very obsessed with death, washing their hand over and over to above the cautionary standard is very high.
One of the greatest, most important sources of anxiety now is information. People get a lot of fake and false news that gets them unduly anxious.
The psychiatrist also advised that children should be closely monitored at this time.
The tendency that the child would exhaust the patience of the parent is very real. You are trying to keep the children sane, you're trying to keep the house together, but because the children want to play around and all that, you keep, your patient keep getting tested. So at a point you will lose it, and it will tell on the child that you're trying to keep together. So yes, there are challenges that the lockdown is a stressor that would affect the children.
They are not going to school, they are not going out to play with friends and neighbors, and they're just at home for prolonged periods. So it's rather unusual for them to. So children can be victims, and then they can have some emotional stress arise.
For the health experts, engaging in healthy activities, enjoying family time and staying connected and maintaining social network with loved ones is key to staying sane and healthy even in the lockdown. Habiba Oladipo, NTA News.